changes in physiology are continuous. That's a wonderful aspect of this business. That is, we're moving now from invasive physiology measures to angiographically based measures of physiology obtained from the angiograms, and correspondence to pressure wire information is very strong.
At about that stage, about 2020, we stopped using wire-based physiology and we actually switched and moved to FFRangio as our first line choice for physiologic assessment. So basically when we have a case where you want to use physiology, we didn't measure physiology with the wire, we would just use the FFRangio and treat the patient according to the FFRangio results.
We have a lot of big studies that are coming out, like the PROVISION study published that it met its primary endpoint. Not only that, but also showed advantages in terms of resources and economic burden for in comparison to the invasive FFR.
So actually, when we looked at the 2-year results, again stratified by the treatment decision, so for patients who had ischemic causing lesions and underwent PCI, the 1 and 2 year event rate was around 5% for 1 year and about 10% for 2 years. And for patients who were deferred, it was about 3% for 1 year and about 5.5% for 2 year results, which again, we don't have a comparator arm for wire-based physiology for similar patients, but if you look at real-world registries of IFR or FFR with large real-world cohorts, again, the 1 and 2 year results are quite similar, perhaps even our results are a bit better.
With the growing body of evidence showing the diagnostic reliability and of course the procedural confidence that we can have in those systems, in the future we might be able to see those angio-based technologies being the standard of care, reserving the wire for specialized settings and more complex scenarios.
I think FFRangio will be automatically incorporated into much of the angiography practice. There's no reason it can't be. Automatically pushed in images, helped by AI to quantitate and produce the number you need, and it'll be displayed right next to your regular angiography. That's the future.